I'm joined now by Jim Ginder, Health Education Specialist for the Hamilton County Health Department. Hi, Jim.
Good afternoon, Tammy.
Hey, we've spent the past many months talking about COVID, but we need to switch gears just a little bit because we're headed into flu season. Talk to us a little bit about the symptoms of COVID and the flu, the similarities, and how maybe we can figure out which one we have.
Great. I'm glad we're really talking about this because I think it's going to be really difficult to distinguish the difference between somebody who tests positive or has signs up for influenza, then you have individuals who have signs for flu as well. And we just don't know currently right now, can somebody have both COVID and influenza at the same time? That's kind of interesting to kind of figure out because some of the signs and symptoms are the same and some of them are different as well. Like a great example, the flu or influenza, you traditionally do not have a fever. I'm not saying that you can't, but usually most individuals who have influenza do not have a fever. And on the other hand, with COVID, one of the signs and symptoms that we look for COVID is a fever, usually above 100 or greater. Another thing that we look at for influenza is a lot of congestion. And again, with COVID, you're going to have a lot of congestion as well, too. One of the major differences that we look for flu and influenza is that loss of smell and taste. So that's a huge one. And also that shortness of breath. Usually with the flu, unless you do not have any previous respiratory issues like asthma, bronchitis, anything like that, you usually don't have difficulty breathing with the flu unless you have some type of prior respiratory medical history. But with COVID, that's one of the symptoms that we're looking for if the person does have symptoms. And we all know with COVID, a lot of these people could be asymptomatic as well, too. So again, with COVID, they could be asymptomatic, but with flu, usually these individuals are not asymptomatic, but they are going to have to be symptomatic.
So we've been real diligent about learning how COVID is transmitted. Is the flu transmitted the same way?
Right, that's a great question, and it is. So the flu or influenza is actually transmitted through respiratory droplets. So we are looking at the same precautions as we do that we have in place now for influenza. So cover your cough when you coughing, or when you sneeze, cover your nose as well too. Also, we're looking for that close contact, trying to stay 6 feet away from each other as well too, and continually to wear that mask as well. And most important, wash your hands with that soap and water for at least 20 seconds, or use that hand sanitizer, and stay home when you're sick as well.
So what I'm hearing is that we prevent the flu much like we would prevent COVID. So these extra steps that we've all been taking, wearing masks and social distancing, could that possibly help make this flu season a little less terrifying?
Right. I would agree with you 100%, just because we're used to wearing the mask, we're used to social distancing. The only concern that I have is the flu season or influenza season usually occurs around the holidays as well too. So I know a lot of families are getting together for holiday events, and that's something that's a little scary to me, just because we have those individuals who possibly could be at higher risk of developing COVID or influenza. And we're putting those individuals at risk as well too.
Yeah. It's going to get colder outside here soon too, so we can't have some of those celebrations outdoors like we've been having.
Exactly.
What about the vaccine? Who should get it? Where should they get it? And how soon should they get it?
That's a great question. So if you visit the Indiana State Department of Health, our website here at Hamilton County, or the CDC's website, there is a list of individuals who are at higher risk for developing influenza. What's interesting is if you look at the risk for influenza, the individuals, it's the same risk for COVID as well too. So our people have those respiratory problems, our people who are over the age of 60, are pregnant ladies as well too. Anybody, as I mentioned, who has any issues of respiratory problems as well too. Anyone with heart conditions, diabetes, anybody who has cancer, any type of health issues that can actually lower your immune system's ability to fight stuff off.
So would you say it's more or less important to get a flu shot this year?
I think it is more important to get that flu vaccine, just because that's just an extra layer of protection. Because for so long we've been using a mask, and I'm telling people social distance and wash your hands all the time. just another tool that we can use to prevent transmission of COVID and also influenza. And the reason why I say COVID is if we don't get a influenza test, how do we know it's influenza? If we don't get a COVID test, how do we know it's not COVID as well too? So that's just one thing that we can check off our list of our vaccines that is recommended to get.
Any other thoughts or suggestions, ideas, or things for people to keep in mind as we start to move to flu season?
Right. So you answered a question. You asked a question. I apologize in the answer. When should you get your flu vaccine? So
Yeah.
it's really recommended when that flu vaccine comes out that you get that vaccine. And we know for kids that have not had their vaccines ever for flu or their influenza vaccine, that those little guys, it may take 2 vaccines to fully protect them. So it's really important if you have little kids that you talk to your healthcare provider to see if they need that second vaccine. And you also mentioned where you could get the influenza vaccine. A lot of our like CVS's, Walgreens, Walmart, Target, who have pharmacies are also giving it. You also may need to talk to your healthcare provider, and we will be doing it here as well too in the near future.
Is it ever too early to get the vaccine? I saw them giving them at Walgreens already this morning, and I know it probably only lasts for so long. So when's the ideal window to get that?
So when you look at flu vaccine, or excuse me, when you look at this flu season, usually it starts mid-September and can go until May, and it usually takes about 2 to 4 weeks. We usually say about 2 weeks for that vaccine to build up immunity or for those antibodies to build up. So that's kind of our key. Once the vaccines come out, especially those individuals who are high risk need to get that vaccine, and also our individuals who are over the age of 60 and 65, they can also get that high dose vaccine as well too. And you really need to talk to your healthcare provider to see if you are at risk, or if you fall into one of those categories to get that high dose vaccine.
I don't want to spring anything on you, but what about the pneumonia vaccine?
Yeah, and that's a great question. And again, I would tell people to talk to their healthcare provider to see if they've had their pneumonia vaccine, or if they need to get it, or do they need to do they need to get a booster, all that type of stuff. So I think it's really important they talk to their healthcare provider about that.
Good. Jim Ginder, Health Education Specialist for the Hamilton County Health Department. Thank you once again, sir. We appreciate it.
Thanks, Tammy.